Hi everyone, and welcome back to my next instalment of Annie's Bite-Sized GP Tech. So today I'd like to focus on accuRx and how we can use it to its at its best, really. So I'm sure you're all aware that there's an accuRx toolbar which floats on your EMIS screen like so. I don't know how many people use it and to what extent they use it, but at our practice at Wideway we use it extensively to send quite a lot of different things. So I'm sure everyone have used the messaging system already, and many people would already know how to do free texting and video calling with accuRx, so I won't cover it here. But from the point of view of managing your patients' online consultations and long-term conditions consultations, there are so many things that we can use accuRx for. So the first thing I just wanted to highlight are the preset accuRx flurries, and you can get them via this tab here, flurry. The most common one that we use is the asthma and COPD flurries. So, for instance, as I was mentioning in my previous video, when I was looking at the all cough template, our recommendation would be that reception sends out an asthma questionnaire first and then books a nurse appointment a week later so that the patient can answer all the questions in time for the review. So this is where reception would go into. So you go into open a new text message, you go onto the flurry tab, and then you choose under that the asthma ACT questionnaire. This is the one that's required for cough. The other ones are old. They would be nice to have, but not essential for cough. So if you tick ACT questionnaire, then this code will be added to the patient's record automatically. So asthma monitoring invitation SMS sent. They would ask the patient to complete the ACT questionnaire via a link. Then you send and save. The result would then come under your inbox here. I can't show you my inbox because I've got lots of other patients on it, so it will be it'll show PID, so I won't be able to show it. But if a patient completes a flurry for you, it would come up as a number 1 on here, like a red number 1, and that means you've got an incoming message. If you clicked on that and then followed the trail, you'll be able to see the message, and under the message there's an option to save to record. If you just click that, it would save directly into the patient record. We can do the same thing for the COPD questionnaire. So these are the two that I use most often, but there are also BMI questionnaire, smoking questionnaire, and the Audit C ones, which admin use quite a lot to gather data. So that's the flurries, and those are preset by accuRx. Then you've also got things that the practice itself could set up in terms of templates to send to patients. So under templates now, this tab here, if you drop down on templates, you can either free text, so no template and free text everything, which takes a long time, or you can create your own templates, which we've created here, and I can go through each of them that we've created, or we can use accuRx templates. Now, there is anything, if you want to search for a particular one like self-certify, you can just tick search under the first few letters and it would pick up any templates that that qualify for that. It's really useful. So for instance, the self-certify, it gives you the link to the Gov website for SSP, the statutory sick pay PDF that patients have to fill in online to certify themselves for the first 7 days. So when patients call up and ask for a sick note, reception team can just ask them how long have you been sick for, and if it's less than 7 days, they can just send them this SMS, and they do not have to actually book with a GP at all, unless the patient has been sick for more than 7 days. I suppose that's when we want to step in. So those are the preset accuRx templates, and there are lots of things there. We use, there are also nice ones with leaflets So for instance, one that would be useful for admin that I use quite a lot would be patients whereby we have received, say for instance, the retinopathy screening DNA, patient hadn't turned up, and we just wanted to let them know so that they can contact us. We can send them this one, so eye screening not done, please book via this link, and you can then add extra information if you wish. And then there are also templates for results, which we use a fair amount. So for instance, a couple of things like over-the-counter or prescription suggestions, vitamin D, that sort of thing. Some interesting ones for the nurses to use the inhaler technique that gives patients links and to patient information leaflets, etc. And some useful places for support in the social and community sector as well. So there's a wealth of information on accuRx that we can use, and more specifically to our surgeries, we can create our own templates, and that is relevant to things where we're doing projects and we're doing sort of surveys, etc. It'll be really useful. So one of our registrars actually used accuRx templates to send out patient satisfaction questionnaires to patients that he'd seen, so that it had a link on it, and then they did that. So it's quite good from a training perspective as well. So the ones we use quite a lot, I've tidied it up slightly and put them under headings. So we've got sort of most commonly used ones, then admin related, then COVID related, then long-term conditions related. And then we were involved in the some research studies, so we've had those as well. So for instance, the latest project that we've been working on was the BP at Home project. So I've written the BP at Home BP template so patients can send, and I've automatically linked the link for them to reply to me. The other thing that's quite useful is we've added the actual codes. So when we come to report on our activities, how many blood pressure SMS invitations we've sent for the BP at Home project, we can search under this particular code and we'll know our numbers. So it's really good for audit purposes and research process purposes as well. And then we've done a couple of ones, like for instance, for if you want a patient to send in their photos, we've looked at the guidelines that were shared by the CCG to look at information governance, consent, and sort of guidelines around sensitive photos. So we've created a template that takes all these into account. And then you can allow the patient to send a photo back to you that way. And this sort of covers everybody as well. The patient will write back to say, I consent, and attach their photo. We've done a couple of self-referral things. So if a patient calls up and wants physio, reception team can simply send this text message to them with all the required information. So a lot of things that we could do ourselves as a practice. Happy to share these templates around. They're pretty generic anyway. So, you can create whatever one you like. There are a lot of admin things that are useful, especially with online access, and with e-consult coming, we probably will need to do another admin related one to acknowledge e-consults and allow clinicians to contact patients that way too. We've brought down quite a lot of long-term conditions stuff, like the diabetes education. We've attached that link to the SMS template. So if you're doing the all QOF template and you're doing an asthma review, it'll say on the all QOF template, have you checked that this patient's had a referral or been offered Desmond? And if they haven't, the link is on the template, but also you can send an accuRx text message to the patient to invite them as well. So that really, in a nutshell, are all the accuRx templates that are available. There's so many, and you can just search for them. Everyone, I'm sure, will probably already know how to use accuRx video, so I shan't go into that now. The other thing that's quite interesting, which we haven't used much of, but we've only used for certain things, is the accuRx pathway. The only trouble with this is I think we're limited as to the number of times we can use it per month due to licensing and things. But it's really useful. For instance, I've got a patient who came for a diabetes check. I did their HbA1c is raised. We've added some new medication and we want them to repeat their blood test in 3 months' time. So what we can do is we could set up a pathway for them. So we could do message one, you know, we've changed, as discussed, we've changed your medication, blah, blah, blah. We'll send you another text in 3 months' time to remind you to book a blood test. And then the message two, which will be sent whatever many weeks, you can choose how many weeks it's sent here. You can choose when to send the next one. It will send, as previously discussed, this is your 3-month reminder to book your blood test. So then automatically in 3 months' time, this second message will be sent to the patient and they'll be reminded to book their blood test. So quite neat. Not sure how many times we can use this per month, and that's something that we need to look at further. Then within that accuRx, you also have the option for batch messaging as well. And this is a new one. At the moment, with the current license that we have, we can only batch message for COPD patients. So for instance, if you ran a monthly search for your COPD patients that are due an annual review that month on their birth date, you can then download that as a CSV file and then upload that onto the batch messaging software. And I was talking to accuRx about this. And the reason that this is, in fact, what they've done is this was their original platform, but because COVID vaccination was such a big thing, they used the software from this platform to turn it into COVID vaccination booking clinics. So it works in exactly the same way as the invitations for COVID vaccinations. So you would upload CSV files in the same way as you would if you were going to invite someone for their COVID vaccine. But this time, the questionnaire that will be sent is the COPD questionnaire. They are working on further questionnaires, but it hasn't yet been released. Again, it may be a case of watch this space to see if we will be able to get it or not. But having the COPD is better than nothing, and it is worth trying and seeing how you like it. So that's accuRx in a nutshell. That's all there is that I need to sort of cover at the moment, but there are other things to think about. If you wanted to know more, let me know on how to create your own templates as a practice or as an individual. There are ways to do that, but I think you might need some admin rights. So I'm happy for practice managers to ask questions, etc. Happy to help. Thanks for listening.